Hello, Mabuhay! It's good to see you here. Welcome to this channel.
My name is Dr. Aye and I'm an ophthalmologist and a skin physician as well.
So here I post about both eye and skin diseases that I encounter in my practice and explain some of the procedures that I do in the clinics.
Today I'm going to talk about a quick, simple, painless procedure called YAG laser, also called YAG capsulotomy.
We'll talk about how it works, why it's used, and what you can expect if you're having one done.
YAG laser capsulotomy is a laser surgery you might need sometime after cataract surgery. Never before any cataract surgery, it's always coming after.
Basically, it's used to address a very common cataract surgery complication known as posterior capsular opacity or PCO. Okay, I'm gonna dive more into this later, but let me clear up something first. Because hearing that, you might be asking, Doc, are you trying to tell me that I'm going to have to go through another surgery after my cataract surgery?
Because many people, when they hear the word surgery, they think about knife surgery, so they get confused.
I know many of my patients think of surgery as having to lie down, get hooked to oxygen, have drapes covering the face, and all that kind of stuff is when they had the cataract surgery done in the first place.
Pero no, hindi. This is not that type of surgery, huh?
YAG is a very quick sit-down procedure that will not take 5 minutes to finish. So let's get this straight. Laser surgeries, YAG cap included, are still considered a form of surgery even though there are no cuts made with a knife.
Imagine this, the laser does the cutting and acts like a blade or a knife to cut into that body tissue.
What I'm basically trying to say is laser is still surgery, just a more high-tech kind. So ayan, now that we have that one sorted out, we'll now go into why this need for YAG laser surgery. Ba't kailangan ng surgery? If you remember during your cataract surgery, we removed your eye's cloudy lens and replaced it with the clear artificial lens called IOL. Now that IOL is held in place in a bag that is a part of the eye. We call it the capsular bag. Weeks, months, or years later, this capsular bag can become cloudy or wrinkled and cause blurry vision. This is now what you call a posterior capsular opacification or PCO. It sounds like a mouthful, but other names would be secondary cataract or scar tissue. And this is the reason why many patients come back to the clinic fearing that the cataract has come back. To them, it seems to have done so because of the clouding of vision brought about by the scar tissue.
The scar tissue can be explained as a natural response of the body to a quote foreign body, which is your artificial lens that has been left inside the eye. And as expected, when we leave something inside the eye, the body will always faithfully do its protective job, which is to react with scar tissue as part of its repair and healing process.
Actually, nothing wrong about the body. It's all good, and it's expected to do that. In fact, 50% of all post-cataract patients will develop scar tissue within 5 years. So with this clouding of the capsule and blurring of the vision, we doctors do the YAG laser to basically clean the lens by making an opening in the cloudy capsule. These will allow the light to pass through again for clear vision. However, not all types of eye doctors are able to perform this procedure because YAG laser is typically performed by ophthalmologists. You see, even your mom might have told you, don't play with lasers, don't point that laser at your brother's eyes. That is such a classic mom warning, and believe it or not, it does have real science behind it. The YAG laser used in the eye clinic is way more powerful than a laser pointer, but it's also much safer because it's focused, controlled, and used in a clinical setting by trained professionals. Look here, this is my actual patient. The laser is focused on a tissue of target by aiming beams. These red dots here are aiming beams.
These red dots tell me where the laser is going to hit, and so I keep all the other parts of the eye safe because these are all focused and I'm using a controlled amount of energy which passes on the YAG crystal. By the way, YAG is an acronym for the name of the crystal, yttrium aluminum garnet. Pretty fancy, huh?
So, yes, now I'm going to walk you through the procedure real quick. Basically, it's an outpatient procedure performed in the clinic, taking only a few minutes. You'll be asked to sit down, your vital signs will be taken, especially your blood pressure, as some dilating drops may potentially increase your blood pressure, although this is uncommon. Your eye pressure, also called IOP, will also be taken, and this measurement is independent of your BP. Now, if you have high BP or high IOP, you may be given pressure lowering meds or eye drops to avoid the spikes. Spikes in any type of pressure, whether BP, IOP, are not always a good thing. After that, your pupil will be dilated using drops for us to see the lens more clearly and get the iris out of the way. Then your eye will be numbed with eye drops, and this is the anesthesia that allows the procedure to proceed without pain. Now, as you can see here, this is the mid-dilated pupil. The pupil is that hole in the colored part of your eye called the iris. Within that hole, you can see the white opacity in the lens, which makes the lens look dirty and cloudy and so obstructing the vision. When the laser fires, don't worry, I'm going to play a clip later. Both the doctor and the patient will hear a click, which coincides with every firing. Now, this is one of the most satisfying things that I'd like to do. It's like playing a Star Wars game. You fire away laser with a press on a joystick and zap the enemy who doesn't even put up a fight. So, here's a clip of the actual procedure. I borrowed a few seconds from Dr. Shannon Wong's video on YAG laser just to give you an idea. Credits to Dr. Wong, the owner of this footage, showing laser firing to create tiny, precise openings in the cloudy capsule. I hope you see that. It's amazing, right, how the laser clears up the lens? It allows light to pass through properly again. So this one instantly improves the vision of the patient. YAG is something else. There is no incision, no stitch, no pain, no bleeding, just focused light doing the job. What's more, the laser delivers energy in very short pulses, measured in nanoseconds, so it minimizes the risk of damage to nearby tissues. It's fast, accurate, and very safe in experienced hands. The entire procedure usually takes just 5 minutes. So these are some of the things to expect after a laser. You may have to wait in a doctor's office for an hour. And here's the reason why, is to check for eye pressure. If all is well and eye pressure is normal after an hour, post-surgery instructions are given and patient may be discharged, but she or he may need someone to drive him or her home to accompany for the commute. On the way home, patient may still feel that it's kind of blurry. Well, that's okay because of the dilating drops. The pupils are still dilated, so it's gonna give us some degree of blurriness, and your eyes will clear up very soon enough after that. It is also common to see spots or floaters a few days or even weeks after the surgery. So if you have no other eye problems affecting your vision, your sight should improve in about 24 hours. Once your vision is clear after procedure, you can usually do all of your normal daily activities. So bear with me here, we're almost done. Thank you for sticking around. Here are some post-procedure instructions. This will be quick. Patients should avoid rubbing the eyes, and they are advised to wear sunglasses for the glare and follow eye drops use. In my practice, I usually give antibiotics plus anti-inflammatory drops for about 1 or 2 weeks. There are no bandages or stitches, but follow-up care is still important. Remember that. So that's it. Thank you. You've given me 10 minutes of your time. I so appreciate you. As a bonus, I'm giving you this trivia flash. Did you know that YAG laser was originally used in industrial settings for cutting and welding before being adapted for delicate procedures like eye surgery? Yikes. So if the doctor tells you you're gonna have YAG laser done, you have an idea now. And I hope this helps you understand YAG laser a little better. Well, thank you very much. That concludes it. I so thank you for having stayed and listened. And take care. I hope to see you soon in my future videos.